I'm Dr. Norman MacLean. I did practice within obstetrics and gynecology for nearly 40 years. I've done in the area of maybe 8,000 births. That would include maybe 2,000 caesarian sections. I have performed abortions early in my career. Over that time I would have certainly done between 100 and 200 terminations of pregnancy. So I know about the technique. I am going to describe now a first trimester medical abortion. These medical abortions are performed usually between 5 and 9 weeks and nearly always less than 10 weeks of gestation. This is a procedure in which the mother swallows pills in order to terminate her baby. The procedure involves 2 steps. The first step, at the abortion clinic or doctor's office, the woman takes pills which contain MIFEPRISTONE, also called RU486. RU486 blocks the action of a hormone called progesterone. Progesterone is a naturally occurring hormone produced in the mother's body to stabilize the lining of the uterus. When RU486 blocks progesterone, the lining of the mother's uterus breaks down, cutting off blood and nourishment to the baby, who then dies inside the mother's womb. It is important to know that even after it has been taken, it is possible to reverse the effects of RU486 and save the baby if progesterone is administered soon after the drug is taken. Step 2. 1 to 2 days after the RU486, the woman takes another drug, MISOPROSTOL, also called Cytotec, and this drug is taken either orally by mouth or vaginally. RU486 and MISOPROSTOL working together cause severe cramping, contractions, and often heavy bleeding to force the dead baby out of the woman's uterus. The process can be very intense and painful, and the bleeding and contractions can last from a few hours to several days. While she could lose the baby anytime and anywhere during this process, the woman will often sit on a toilet as she prepares to expel the child, which she will then flush. She may even see her dead baby within the pregnancy sac. At 9 weeks of gestation, for example, the baby will be almost 1 inch in length, and if the mother looks carefully, she might be able to see the arms and legs. After the mother has disposed of her baby, bleeding may well continue to occur. This can last between 1 and 2 weeks and occasionally last more than 30 days. This bleeding can require the mother to be hospitalized if it continues to be heavy and troublesome. This failure rate increases as the pregnancy gestation increases. If failure occurs, she will usually be offered a surgical abortion. For the mother, medical abortion often causes abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Very rarely, maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy. I stopped doing abortions because I realized this is not right. This is not what I should be doing. This is not the medicine, the life-giving, healing medicine that I wanted to practice. And from that day, I stopped.